Hello everyone, today we are going to discuss about protein binding of drugs. Protein binding process is start just after the absorption. What is absorption? The transfer of drug from site of administration to systemic circulation is known as absorption. Protein binding process is very important process for distribution of drug from systemic circulation to the targeted organ or cell or tissue. So, what is protein binding? The phenomenon of complex formation of drug with protein is called as protein binding of drug. There are n number of interacting molecule which binds with protein and form a complex. That interacting molecules are generally macromolecules such as DNA, protein, adipose and blood components. As a protein-bound drug is neither metabolized nor excreted, hence it is pharmacological inactive due to its pharmacokinetics. Here you can see protein plus drug reversible bound with each other and form protein-drug complex. Protein binding may divide into two categories. First one is intracellular binding and second one is extracellular binding. Now, mechanism of protein drug binding. Generally, protein drug binding is reversible process, but in some cases, this process is also irreversible. Reversible bound of drug is generally due to formation of weak chemical bonds such as hydrogen bond, hydrophobic bonds, ionic bonds, van der Waals forces. But if drug irreversible bind with protein, they leads to carcinogenicity or toxicity. Here you can see the diagram. Blood where free drug are present, interact with plasma protein and form a protein drug complex. Then the drug will distribute to the targeted organ, tissue or cells with the help of receptors. It is reversible process. After the pharmacological response, the drug protein complexes separates and again form a free drug. Then again that free drugs bind with another protein to form protein drug complex and leads to metabolism process. After the metabolism, the drug will excrete out with the help of urine through kidney. Now, binding of drug to blood components. Blood components are plasma protein, blood cells, just like RBCs, WBCs, platelets, etc. So, the binding of drugs to plasma proteins is reversible process and it is totally dependent upon the binding affinity. Just like here you can see the extent or order. Albumin have more affinity, binding affinity than alpha 1 glycoprotein. Alpha 1 acid glycoprotein have more affinity than lipoproteins and lipoproteins have more affinity than globulins. So first is human serum albumin. It is the most abundant plasma protein having molecular formula of 65,000 Dalton. It has four binding sites for drug binding. Site 1 is for warfarin, site 2 is for diazepam, site 3 is for digoxin, site 4 is for tamoxifen. Both endogenous compounds such as fatty acid, bilirubin, and the drugs are binds to human serum albumin. Next is binding of drug to alpha-1 acid glycoproteins. It has a molecular weight of 44,000 and alpha-1 acid glycoprotein binds only basic drugs just like imipramine, lidocaine, propranolol, etc. Next is binding of drug to lipoproteins. Lipoproteins are classified into four categories: chylomicrons, very low density lipoproteins, and high density lipoprotein. It has molecular weight of 2 to 34 lakh Daltons and composed of triglyceride, cholesterol esterase, and apoprotein. Only lipidic nature of drugs are bound with lipoprotein with the help of hydrophobic bonds such as diclofenac, cyclosporine, and chlorpromazine. Next is binding of drug to globulins. Globulins are further classified into five categories: alpha 1, alpha 2 globulin, beta 1, beta 2 globulin, and gamma globulin. And alpha 1 globulin binds to steroids drugs just like thyroxine. Alpha 2 globulin binds drug just like vitamin A, D, and K. Beta 1 globulins is a binding site for ferrous iron. Beta 2 globulin is binding site for carotenoids, and gamma globulin is binding sites for antigens. Next, binding of drug to blood cells or blood components. RBCs are the major blood components and having 500 more times diameter as compared to human serum albumin. The rate and extent of entry into RBCs is more for lipophilic drug. It means lipophilic drugs are bound with cell components. More the lipophilicity, more the binding. Means lipophilicity is directly proportional to the binding of drug into blood components. RBCs comprises of three components. First one is hemoglobin, second is carbonic anhydrase, and third one is cell membrane. Hemoglobins bind drugs like phenytoin, phenobarbital, and having a molecular formula of 64,500 daltons. Carbonic anhydrase inhibitor drugs are like acetylzolamide, chlorthalidone. Cell membrane drugs are like imipramine, chlorpromazine, which binds with RBC's membrane. Next is binding of drug to extravascular tissue protein, just like liver, kidney, lungs, muscles. These are extravascular tissue and are capable to bind the drug. For example, liver. Liver irreversible bind drugs like halogenated hydrocarbons and paracetamol. Lungs binds basic drugs like imipramine, chlorpromazine, and antihistaminic drugs. Similarly, kidney, skin, eye, hair, bones, fats, nucleic acid, these all are extravascular tissue and they also binds some categories of drugs. And the drugs are mentioned here, just like kidney, skin, eye, hair, bones, fats, and nucleic acid. Next is the factor affecting protein drug binding. So the first factor is drug related factor. And the drug related factor is classified into various categories. So first category is physiochemical character of the drug. So protein binding is directly related to the lipophilicity, and lipophilicity is directly proportional to the binding. It means increase the lipophilicity, increase the extent of binding. Second is concentration of drug in the body. Alteration in the concentration of drug substance as well as protein, the molecules or surfaces subsequently bring alteration in the protein binding process. It means if the concentration of drug is lower down, if the concentration of protein is lower down, it fluctuates the binding process. Next one is affinity of drug for a particular binding component. This factor entirely depend upon the degree of attraction or affinity the protein molecule or tissue having towards drug moiety. For example, digoxin has more affinity for cardiac muscle protein as compared to skeletal muscle or those in the plasma like human serum albumin. Next factor is protein tissue related factor and it is further classified into various categories. So first category is physiochemical properties of protein or binding agent. Lipoprotein and adipose tissue tends to bind lipophilic drug by dissolving them in their lipid core. The physiological pH determines the presence of active anionic and cationic group of the albumin to bind a variety of drugs. It means if a drug is lipidic in nature, it is easily bind with lipoproteins. But if drug is not in lipidic nature, or we can say they are hydrophilic in nature, the drug are not capable to bind with lipoprotein or adipose tissue. Second one is concentration of protein or binding components. Among the plasma protein, binding predominantly occurs with albumin as it is present in high concentration in comparison to other plasma protein. So it is very important factor that concentration of protein is directly affect to the binding of drug because human serum albumin found in large amount and human serum albumin is the biggest site for drug binding to protein. So if the concentration of protein is lower down, then it directly affect to the binding of drug with protein. Next is drug interaction. It is a competitive process. A competition between drugs for the binding site, also known as displacement interaction. If there is any another molecule which interact with protein and bind with protein, the drug is remain in free state. So the pharmacological action will not be achieved. So this is the major factor which affect the protein drug binding. Next is patient related factors just like age, low albumin content, more free drugs for neonates, young infants, high dose of desoxyn due to large renal clearance, elderly, low albumin, so more free drug. Intersubject variability due to genetics and environmental factors. Next is disease states. Disease state just like if any disease is present, so it also affect the protein drug binding. Just like renal failure results in low albumin content, and if low albumin content was found, so it leads to low binding of acetic drug. Neutral and basic drugs are unaffected. Hepatic failure shows low level of albumin synthesis, which is directly affect to the protein binding. Now look into kinetics of protein binding. Here P represents free protein and D represents free drug. Then applying law of mass action to reversible protein binding, when protein and drug bind with each other, it forms protein drug complex, which is reversible process. At equilibrium, here Ka represents association rate constant. So Ka equal to Pd means protein drug complex divided by free protein free drug. Then on rearranging the equation, we get protein drug complex is equal to the association rate constant, free protein and free drug. Now if Pt is the total concentration of protein bound and unbound, then Pt equal to Pd protein drug complex plus free protein. If R is the number of moles of drug to total moles of protein, then R equal to Pd protein drug complex divided by total concentration of protein. On rearranging the equation, we get Pd upon Pd plus P. How you can get this equation? With the help of putting the value of this Pd to this equation. Then again Pd equal to Ka free protein free drug. Here you can see Pd equal to Ka Pd. So this equation values will put into this equation. So we can get Ka Pd plus P. And again then rearranging the equation, we get Ka association constant free drug divided by association constant free drug equal to K. Because if there is only one binding site, then P equal to 1, and if P equal to 1, then multiply the whole equation with 1, so we get this equation. If more than 1 or n number of binding sites are available per molecules of protein, then the equation will be R equal to N KAD upon KAD plus 1. The value of association constant Ka and the number of binding sites N can be obtained by plotting the above equation in 4 differential ways. So there are 4 kinds of plots. With the help of association constant value will be find. First is direct plot, second one is scattered plot, third one is plot, and last is Hitchcock plot. So thank you.